Our medical doctors are by far the most highly trained and educated people in the world. But what's not taught in medical school? Let's look into that. For centuries, people used energy, natural substances, and self-care for their wellness programs. Now, as science and medicine advanced, these methods were often relegated as wives' tales or alternative medicine, not the real thing. Well, today, these old wives' tales are making a comeback, and that combination of the old and the new may very well be the best option. I'm Frank Zaccari. This is Energy Healing and Integrative Medicine. My associates and I are putting together a plan for a series of wellness centers, which will provide the integration of complementary, energy, and alternative wellness. And this is how I met my guest today, Tina Nunziato and Dr. Liz Cruz, who believe this combination we just mentioned is the ideal option. Now, I visited their offices in Phoenix last week, and I can tell you these are two truly amazing people. So Tina and Dr. Cruz, welcome to Energy Healing and Integrated Wellness.
Thank you, Frank.
Thank you for having us.
Now, we checked out after seeing your place and reviewing some of your background. You both have some really interesting backgrounds and travels on how you got to where you are. So would you share, Tina, let's start with you. Share with the audience, how did you get to where you are?
Oh my goodness. Well, I went to ASU and got my degree in marketing, and then started in telecommunications, and ended up having a friend of mine who wanted to start a business, one of the .com businesses during the .com boom. So moved to San Francisco to do that with him. And that's where I met Liz, who was doing her fellowship in GI, and sold my business from there, came home. We got together, we're married, we had a family, and she came out here with me to Arizona, and we started medical practice because she wanted to be a mom and a doctor, and working out in the regular medical world, you just couldn't do that. You just too much call. So we decided to start an outpatient practice, basically. Mm-hmm. And I told her, I'll run the business and you be the doctor, basically, because I have the startup experience, So okay. About a year in, she came to me and she said, I'm healing, I'm seeing all these people and I'm working them up and I can't figure out what's wrong with them. All their tests are coming back negative. I'm seeing younger and younger patients in the office and just I don't want to have to put a 20-year-old on a PPI medicine for the rest of their life. Something's not right. And so she and I started on this journey and of figuring out what can we do to help our patients get better, because she's not the type of doctor to tell a patient, I don't know. She wants to figure it out. So exactly. Yeah. So I went back to school to get my certificate in holistic nutrition so that I could deliver the wellness side of what we do, since she's scoping butts most days. So that's where we're at. I've been running the wellness side and running the practice since 2007. It's crazy. We were just talking about how many years it's been since we started all of this.
It's amazing. Dr. Cruz, share a little bit about your story.
Yes. So I went to Loma Linda University School of Medicine in Loma Linda, California, and I got my medical degree, and then went on. I was in the Navy. The Navy paid for medical school, so then I went on to do my internal medicine residency, and then got deployed to Guam, where I practiced internal medicine for 4 years. And then while I was there, decided that I really wanted to go back and do more training in gastroenterology, which was really a love of mine. And so I came back to the States and went to UCSF, completed my fellowship in gastroenterology, which is where I met Tina in my last year there. Tina and I met ironically in church, and then Tina brought me to the desert. Tina brought me with her.
Well, it's Tina's fault.
It's all my fault.
Tina brought me here, and like she said, we started the practice in 2007, and she agreed to run the business part while I played doctor, and it's actually been a perfect combination. But about a year into it, like she said, I started to get really frustrated because I just found myself prescribing medicines, and if this one didn't work, just switching off to a different medicine. So I was practicing medicine as I was taught. And once we started our journey around that time, I remember thinking back to medical school and thinking back to how the pharmaceutical reps were there from the beginning, like from the inception of us starting, like we were babies and they were there and they were dining and wining us and taking us out. And, we had no idea what was going on. We just thought, oh, this is wonderful. They love us so much.
Yes.
They love us so much. So we started on this journey, and we were calculating back. It's been over 12 years because our twins are 12 years old. And I remember she was pregnant with the twins when we were well into starting our journey. And I basically said, I don't know what to do. Something's not right. I'm doing colonoscopies, upper endoscopies, CAT scans, ultrasound, blood work, everything, you name it, prescribing medicines like crazy. And patients are still coming back, not feeling well. So there's something missing. And that's what put us on a new chapter of our lives and our career in regards to trying to figure out what the missing link was.
It's putting care back in healthcare.
Absolutely.
That's wonderful.
Absolutely.
Now, Dr. Cruz, Dr. Andrew Weil, I hope I'm pronouncing his name right, he said in some research I was doing, I don't think we have a healthcare system in the United States. He said, what we have is a disease management system. Is that what you see?
Absolutely. Absolutely. I mean, that's what basically what I was doing was just playing with the different medicines. Okay, this one doesn't work. Okay, well, good for you. We still have 4 more in that category. Let's just continue cycling you through the different medicines, and hopefully we'll find one that works and that takes your symptoms away.
Yeah, the system right now is really about putting a Band-Aid on the symptom. It's not about fixing it. And a lot of times the Band-Aids are medicine, and those medicines can be very toxic. And so what we found with patients is that they get on one medicine, and before you know it, they're on another medicine and another medicine and another medicine. And they look back 5 years later and they're like, how did I get on these 10 medicines? So it's not about getting people well today.
Right. It's always been about treatment in the United States. And Dr. Cruz, as we were researching the wellness centers, one of the things we found, we keep seeing this over and over, is that stress and trauma are the root cause of many, not all, but many chronic illnesses. Yet there's a standard of care. So how does the standard of care address these root causes?
Yeah,
It
doesn't. Right. That's a great point. And I totally agree with that. The problem is that there isn't really a good way in which this is addressed. I mean, we, first of all, medicine has just changed so much. It's about how many patients we can squeeze in. You're lucky if you have 10, 15 minutes with the patient. And so you're basically, they're trying to tell you what's going on, and you're basically just quickly formulating a plan. Okay, well, we're going to do this. We're going to send you for a CAT scan. We're going to set you up for a colonoscopy. We're going to do this blood work. Okay, we're done. Have a great day. There's no time for even delving into, well, what's going on with you? What's going on at home? Tell me about your relationship with your family, with your kids, with your spouse, with your partner. Tell me about what you're eating. It's like, first of all, that crunch on time that's made it really difficult. And, the medical system has become such that if you don't see so many patients, you almost get like penalized. Number one, from the reimbursement standpoint, the reimbursements continue to go down, but yet we're supposed to provide this quality care efficiently. And so that's a huge issue. But as far as addressing traumatic events, stress, and all that, I mean, I'm a huge believer that is such a big player in disease that we're seeing these days.
Especially digestive issues.
Absolutely.
A lot of people stress goes right to the gut. And a lot of them are having digestive issues because of stress. And we don't uncover it until they get to the consult with me, the more naturopathic type consult, where I'm spending at least an hour with them,
Wow.
and we're really diving into what are they eating? When did all this stuff start? What happened in your life when all this stuff started? And a lot of it does stem from a death, a loss of a job, just something traumatic that happened with their child. It's crazy when they actually go back and they realize it for themselves that, oh yeah, it was, this is what happened around that time. And I started having these issues after that, and it's all connected. So trying to just help them realize where it's coming from so that they can heal from it. Because that's where the healing, like you said, Frank, the healing has to happen that deep, right? If they're going to get better. No amount of medicine is going to help with that.
Let's stay on that topic, Tina. You're a certified holistic nutritionist. And when someone comes in and they've been taking meds and for probably years, how do you suggest an alternative to the drugs? Because it's almost become ingrained in our culture.
Yeah, we have to start slow, by the way. It's not like they come in and I'm like, okay, stop taking these 10 things. They're all, they're on them for disease management, right? A lot of people will tell me, oh, I'm healthy. I'm only taking these 5 medicines, but I'm healthy because everything's being controlled. My high blood pressure is being controlled. I said, no, that's not health. That's disease management, right? So you still have the disease. But we do it very slowly in baby steps. They obviously got to that situation in baby steps, so we have to unwind them in baby steps. So we typically I always start with 2 or 3 things that are really critical to them specifically. And it could be anything. It could be some supplementation. It could be getting deep tissue massages or sitting in an infrared sauna, or it could be changing up their diet, increasing their water intake. Just starting to move their body. Some people who've been sedentary for a really long time, I'm not going to go tell them to go to the gym. We need to start by stretching, right? Let's just stretch every day. And maybe if you stretch every day, you'll feel motivated to go for a walk around the block. And then maybe if you're motivated to do that, you'll go to you'll go in the pool. There's steps you have to take. You can't just take somebody and just say, after a month you're healed, right? I tell them that it's a journey. It didn't take you overnight to get here, and it's not going to take you overnight to get out, but it is a journey. And we've seen a lot of success taking people very slowly through the steps.
Right. I think that is absolutely the key that I've seen, is that when someone comes in, as we talked about in your office last week, and they've been on this diet for 50 years, they're not going to change.
Exactly.
So what one thing can we do, and then layer that? There's another thing, that your son wrote a book, which I read, on digestive health for children, which is amazing. It's just amazing. And Tina, you had told me when we spoke, you discussed this program with a large number of doctors, medical doctors, and they seem reluctant. What's your perception on why there's this reluctance?
Yeah, so we had our book out for a couple of years already, and then our son, who was 9 at the time, he said he wanted to take it out to kids, which I thought was great. It ended up taking him 2 years to write the book, but he was 9.
It doesn't matter.
So when he published it at 11, I told Liz, I was like, I really want to take this out to pediatrician offices, just because we know let's start targeting the kids, right? Let's start teaching them now about their bodies and how they work, so that we're not having all these issues when they're 20 and 30 years old, right? But the pediatricians that I went out to, everyone was they're like, oh, this is a great book. This is a great concept, good for your son. But it's just not going to work. We just can't do it here. And I'm like, well, why not? Pretty much every single one. And I probably hit like 25 pediatrician offices in the Valley. And it was mainly because they're like, look, we're sitting here, like childhood obesity and childhood diabetes is through the roof. Okay.
Yes.
And they're like, we're basically sitting here in front of obese parents with obese children, and we're telling them this is a concern. Your child is obese, and they're looking at their child like they're fine. I'm fine. They're fine.
Yep.
Right. And so they're not understanding that this child is not fine, and that at the age of 8, the child should not be obese. And so they're not going to be motivated. Again, they're eating the same diet that their child is eating. It's the only diet that they know. The doctors don't have enough time. All they say is eat better, right? Eat a better diet. That's what they say. And they say, okay, now we're going to send you on your way. But they don't know what that means. What does eat a better diet mean? They're used to going through McDonald's every day. So yes, everyone knows that McDonald's isn't great. The problem is they don't know how easy it is to eat better. And actually how I would say even cheaper today to eat healthier. I mean, a lot of people years ago, when we first started this a decade ago, people were like, oh, it's so expensive to eat healthy. Today with fast food, the prices are going up with fast food. You just can't get a burger for $1 anymore. Right. So when you really look at how much money people are spending on eating out, it's not cheaper to eat healthy. It's actually less expensive to eat healthy today. So, but just teaching people how simple it is to get back to eating real food again. And the other thing is I did a consult with a woman yesterday who doesn't have energy to cook because she's tired, low energy, brain fog, aches and pains. The typical symptoms of somebody who's been eating a bad diet. She was 35 years old and she can't motivate herself to get in the kitchen because she doesn't feel good. Right. But I told her what's happening is that this is the vicious cycle of I'm going to keep eating out because I don't feel good to cook for myself. And the reality is it's the eating out that's making you not feel good to cook for yourself. So you have to slowly start getting back into the kitchen. You have to slowly start eating healthier to motivate yourself to do more. But if no one teaches that, really, I kind of call it tough love in a way, right? Because people are constantly told what they want to hear. And I'm usually the one to kind of smack them upside the head and be like, no, you got to get back in the kitchen. There's no alternative to getting back in the kitchen. And it can be simple. I mean, we have 4 kids. I don't have time to be in the kitchen for an hour every night making dinner. Our healthy dinner takes me a half an hour to 40 minutes to make every night. And I don't care how busy we are as a family. We've got kids running in 3 different directions. I still have time. I make time to make dinner. Even if we're eating at 7:30. 8 o'clock at night, I'm still coming home and making dinner because that's how important it is. Exactly. We tell our patients all the time, you have to plan for eating. They just can't be, oh yeah, we're all hungry. Now what are we going to do? Because if that's the case, you're going to make a bad choice every time because what's around us, bad choices, right? So you have to always have a plan for being hungry and eating.
Absolutely the case. Now, Tina, let's touch on the elephant in the room here. What's the impact of the insurance industry on this?
On getting people better?
Yes.
Well, I would hope that they would realize that it's going to save them a whole ton of money, but they don't see it that way. I called the insurance companies over a decade ago, asking them to allow us for patients to use insurance money for their supplements. For example, would insurance cover the supplements? And they say no. No natural supplements can be covered by insurance. And it's unfortunate because people will need them just as much as they need omeprazole, right? Yes. I mean, people are taking our enzymes and probiotics every month faithfully. So money is being put out. To me, the insurance companies want people to be sick. I don't know why. They're just putting more money out for people to be sick than they are for people to be well. But somehow it's making them a ton of money.
Oh, yeah. They're very wealthy.
Yes.
Dr. Cruz, what would you add to that?
No, I agree with that. I mean, it's definitely a very wealthy industry. Yes. And if it's not, what's going to make the money is going to be the medicines, the prescribed medicines. And I mean, it is truly been an issue for us with a lot of patients who can't afford to buy the supplements and tell us, oh, I wish my insurance covered it. And so it's been an issue. And like Tina said, they're not out for the wellness of the patient, in my opinion. I mean, disease is what makes them money.
Yes, it does on both sides, the insurance industry and the pharmaceuticals.
Absolutely.
It's incredible. That I'd worked in the insurance industry. In fact, I owned an insurance agency. And one of the things that just blows me away is having this alternative option is significantly less expensive for the insurance company. And they're not going to move until the corporations say, we're tired of paying this. And we're going to put these kind of programs in. So that's part of what we're going to be working on to try. You're hitting your head against a brick wall, but we're gonna knock down that wall. It's gonna happen.
Honestly, Frank, the system is so broken. Like it's gonna have to break at some point, because even I was telling our rep this past year for our own practice, for our own medical insurance, for our staff. I mean, the rate, and this is, I'm sure corporations across the nation, I mean, rates continue to go up every year. At some point, this person's going to be paying more in medical insurance than they're making for their salary. Like you can't do that. Like at some point it's going to break, and then doctors too, like especially out here in Arizona, I don't know how it is in the rest of the country, but doctors can't afford to have their own practice anymore with how low reimbursements are. So rates of insurance keep going up, reimbursements continue to go down. You've got less doctors, right, that are out there. They're merging with hospitals, they're being bought out by bigger groups. But then they're even struggling, hospitals are struggling. Like at some point, this economic situation is going to implode. Yes. And either you're going to have a ton of doctors exiting medicine, which is really going to leave us in trouble because you've got all these sick people, right? Everyone's getting sicker and sicker, not healthier and healthier. And you've got a lot less doctors. So it's incredible. I mean, something is bound to happen very soon.
It's going to happen. It's just a matter of just continuing to push, and that's what we're going to do. Now, Dr. Cruz, you said something today, and then you said it to me when we were in your office, that you're seeing teenagers suffering with gastric issues that you don't see until people usually 40 or 50. Is that right? Now, in a perfect world, let's take the insurance companies and the biotech out of here. What would you want to offer? What would your recommendations be?
Well, I mean, we've started, first of all, our practice is mainly adults, but we do end up seeing some teenagers that are, almost 18 years old, and especially the kids of our adult patients that have been with us. They've got a teenager who's almost 18 or who's 19. Hey, would you please see our kids? Tina has actually been seeing children from the nutritional standpoint. And, that's been one of her huge passions. But, again, the big thing is trying to educate the parents in regards to the diet. Because like Tina said, if you've got an obese parent here and an obese child, to that parent, they don't see anything wrong, because they are who they are, and their child may be obese, but to them, that's fine. I would say the biggest thing is teaching them about nutrition, because I think one of the biggest problems that we're seeing now in these young adults that are coming to us, 18, 19, even our adults in their 20s, that we're seeing a ton of these patients, has been the diet that they've been on for the last, almost 2 decades. The fast food, the highly caffeinated energy drinks, the fancy coffees. I mean, the consumption of non-water beverages here in this country, sodas, coffees, and I mean, it's through the roof. When we talk to our patients about what do you drink, how much water do you drink, most of them look at us like we have 3 eyes. Well, what do you mean?
Well, I drink coffee and there's water in coffee.
Yeah, I have six Cokes or whatever,
Isn't that liquid?
I put ice in the Coke, so there's the water.
Yeah,
exactly.
The ice, right. That's
Coke.
probably about the only water that they're getting. But I think the biggest thing is what they're eating. And so, like Tina already said, I mean, the way that we've been doing this whole thing in our practice with the hybrid of doing the traditional and then the more holistic is basically they come in, I still have a standard of care by which I have to abide by with gastroenterology. We do the workup and make sure that there's nothing bad going on, make sure there's no tumor or any, an ulcer or anything like that. And then from there, then send them over to Tina, to our nutrition team and let them take it from there as far as counseling the patient, doing a consult with them, and talking to them about their diet and the baby steps, what Tina said, the baby steps, and just teaching them, if they're not drinking any water, we have to slowly make that transition with, okay, so cut out 1 can of soda and incorporate 1 bottle of water, and just slowly make those changes gradually as far as teaching our young people and the parents of the children also.
In my high-tech life, I traveled overseas extensively, and I didn't see this crisis as much when I would travel overseas. And I read a statement that said U.S. has 5% of the world's population, but consumes 80% of prescription drugs. Is that right? Is that an accurate statement?
Probably
Sounds
correct.
about right.
Yeah.
Wow.
We did, when we first started our wellness stuff, we did a survey of all of our patients. We surveyed probably over 250 people.
Mm-hmm.
And no joke, 95% of them said they had high stress. 95%. We're talking everywhere
All
from an
ages.
18-year-old all the way up to a 98-year-old, high stress. And about half of those people were on anti-anxiety and anti-depression medicines. Half. Okay. Our son was actually just telling us last week that most of the girls at his high school are on antidepressive and anti-anxiety medicines already in high school. It's like,
Yeah.
and I'm thinking high school, like this is when you're supposed to have drama. This is when you're supposed to, be a little bit depressed or a little bit angry. You've got hormones rushing through your body like crazy. Let it go. Like let them grow like they're supposed to grow. Let's not try to put a Band-Aid on it. As soon as somebody gets angry, right? As a teenager gets angry or a teenager gets, that's totally normal. Like
Yes.
Teenagers are going to act like jerks for a little while, it's like, it's what's happening in their life right now. But parents, like, I just find that this society, there's something wrong, let's put a pill on it.
Yes.
And that's a huge problem in our country today, because now we've started this child on anti-anxiety and antidepressants. And I can't tell you how many 25, 30-year-olds I'm doing consults on where they've told me they've been on an antidepressant since high school.
Wow.
And look at where they are
Mhm.
10 years later. Okay.
Mhm.
This is like mass education that we need to do in this country. It really is, because we are, as a system, we are very broken in that the way we think about how to take care of ourselves is so backwards. And it's damaging a lot of young bodies. Let's just say that.
Yeah.
I met with a school psychologist yesterday, and this was interesting because she said, and I read your son's book about stress on kids, which was amazing. So I asked her that question, and she said, Frank, our youth are under so much pressure. They don't have, they're carrying around the old Franklin, it's all online now. And they're scheduled almost every single minute of every single day, that they don't have time to be children anymore, number one. And number two, the cost of school. And this was interesting. The cost of college, the college education is off the charts. It's unbelievable. And the pressure on them to have a 4.8 GPA is also becoming real. Now, to me, that plays very much into everything you've been saying. Is that right?
Yeah. Yes,
absolutely. I mean, when we were kids, I mean, no child had a resume. Now our children have, you have to have a resume for them for what, all sorts of activities, submit the resume and we'll, compare and see which child is better.
Right.
Yeah, it really is incredible how competitive. I think social media also plays into stress level for kids. It has to be really hard to be a kid today with social media and what's being posted about kids, and how people talk about kids. Huge impact on their lives and the way they feel about themselves, their self-esteem. Like when we did something bad in high school, people talked about it for a couple days, and it was gone. Right now it's posted. I mean, that could be your life for the next 2 years, right? Because of one stupid thing you did. I mean, It really is an incredible tornado of stress
It is.
on these kids. And so, yeah, we try in our house to like shelter them as much as possible from those things. You know, we try to keep them busy just enough to keep them out of trouble, but give them time, you know, to be who they are. And it's a tough balance. You know, it really is. And what I've noticed from a lot of parents is they don't want to engage with their children. And so a lot of times it's, here's the device, right? Go away. I'm watching TV or I'm doing work or whatever, you know, here's the device, here's the device. Even, you know, we've noticed it even 10 years ago. We'd go out to eat and the kids would all be on their devices and the parents would be also on their devices. And it's like, nobody's talking to each other anymore. Nobody's having interaction. We were just talking about that at church recently, how the human touch has left, right? And the human touch is so healing. And we've completely disconnected with social media. I mean, there's so many things around social media that could be talked about, but really trying to shelter kids from all that for as long as possible. And I think with just the idea of giving the kid a device at the age of 3, that's not sheltering them.
Not gonna work.
You know, you're throwing them right into the storm. So.
Now, how was COVID and all the social isolation added to the problem?
It's exploded it. I mean, it's so much worse than it was before.
Definitely magnified it quite a bit.
Yeah. Everybody's angry. Everybody's angry about something. Honestly, it is really hard to come across a patient these days that's nice. I mean, it's really sad. It feels like everyone's hanging on by a string.
Yep.
At this point.
Yeah, it's really sad. It really is. We have definitely noticed that over the past year with our patients. I mean, they're just, you know, the stress level has just through the roof, even more so than it was before. You know, people are scared. I mean, there are so many unknowns. I mean, just the fear factor with this COVID. You know, now you've got a new strain that's out and people, you know, now it's at the surgical center. Now it's the talk because, you know, now there's been the big push for the mandate on vaccinations in order to be able to work at these centers, and patients coming in and having to get tested if they don't have a vaccination card, like just a lot so much more.
It was already bad and now it's just more.
It's gone off the charts.
Yeah.
And it's almost your whole life got turned upside down like that.
Yeah.
Now, if it was like a 5-year, that's one thing. But the kids are in school on Wednesday and on Thursday everybody's home.
Right.
And so that kind of an adjustment is massive.
Yeah.
And it didn't help at all. Well, I know you ladies, you're extremely busy and I know you've got to leave soon. So what last thoughts would you like to leave with the viewers? Dr. Cruz, let's start with you.
Well, I think that one of the biggest things that we've tried, you know, there's no question that there's got to be some change made. You know, people are suffering, people are hurting, not only physically, but emotionally. There's a lot of stress. And what we've tried to do in our little world is to be a little light there to help our patients. And when our patients come in, it's very visible when you walk into our practice that there's something different. We've got posters up and, you know, that trigger a lot of questioning from our patients. You know, we don't push our holistic what we do from a holistic standpoint. We don't force it or push it on anyone, but it's very obvious. And so patients are always asking, and, you know, we've told our staff, listen, you may be the only light in this person's life today. So when they come in, you know, the goal is to be a little light in their lives, because we know that there's a lot of pain. And so, you know, we want to try to help our patients, teaching them, and as Tina mentioned, doing everything in baby steps, you know, trying to make changes in baby steps and trying to guide them and be there for them. And we make ourselves very available for them on many different levels, you know, texting, email. I mean, there's all sorts of ways for them to connect with us. But our goal is to be a little light shining there for our patients. We know that there's there are a lot of people that are needing that extra little light, and if we can make a little impact in one person's life, then to us that's major, and we
Done
feel
a
like
great thing.
that's what we're there for.
Tina, what would you add to that, since you're in the real heat of the battle here on the other side of the fence?
Well, I just think I'm excited about what you're doing, Frank, and trying to take this message out at a bigger level. I mean, Liz and I are on the ground, right? Battling day in and day out, one patient at a time, trying to get this out to the masses and help them realize the importance of the focus in this area, I think is awesome. And we're excited to be a part of it with you, and hope that we can take what we're doing in our little area of the world and just explode it everywhere.
It's going to happen. It's going to happen. Well, ladies and gentlemen, as I said, we're just about out of time. I want to thank Tina and Dr. Cruz for sharing this vision and really, truly putting the care back in healthcare, which seems to have gone away. Now, ladies and gentlemen, as I say every week, no matter what obstacles life throws at you, and you've heard a bunch of them here today, please do three things: look up, get up, never, ever give up. If you want more information with Tina or Dr. Cruz or our wellness centers, contact me. You can go to their website. They have their own podcast, which you can see behind you there. And if you send something to me, I will make sure it gets to them. I'm in Phoenix every month. I can see them all the time. You can see this conversation on ROKU TV or on my YouTube channel, and now it's also going to be on Be Connected. Let me leave everyone with this. None of us are in this alone, and the secret to walking on water is to know where the rocks are. Join us next week. We'll get into another life-altering event. Ladies, thank you very much.
Thank you,
Thanks,
Frank.
Frank.